Alright, this is Jalissa, and she's my last model, and I'm gonna show you on her what a standard acupuncture treatment looks like. So again, these are the needles, and they're really, really thin. These are the standard size, especially for children. Unless somebody is just of a larger frame or weighs a little bit more, this is about the size that we use. It's about just over an inch. It's also, again, very thin. And they're all disposable needles. They're single uses. So every time I use a needle, it goes into a sharps container, and then that's delivered to a disposal company. We don't reuse the needles. We don't clean the needles. It's just not worth it. So the first point that we're going to do is an overall point that just makes people feel better. Take a nice deep breath in for me. And exhale. I like to simulate the points with touch beforehand, just because it distracts the skin so you don't always feel the pinching of the needle right away. That's it, and then you relax your hand for me. Yeah. And one more. The ones at the top of the head are really nice because they always improve focus and help it and clarify the mind, so it's easier to learn new things, concentrate on different subjects, and just be in an overall good mood. Now once the patient has her needles, she just lays here 15 minutes to 30 minutes depending on what they can tolerate, what they can handle. And then we pull the needles, we have them sit up slowly, and generally they feel relaxed, they feel a reduction in pain wherever that pain may be. If someone is experiencing low back pain, then we would flip them over and treat them face down like I treated AJ. But with the acupuncture, and they would just lay there for a few minutes, and if they're not comfortable, we can have a conversation or we can play music, or like I said, if they've just decided that therapy needs to be over, we can always pull the needles and either move into ear seeds or move into the NPS, the Neurostim, whatever is most comfortable for your child. In most cases, we won't actually know what your child is comfortable with until they come in. Once they get to know me, once they start understanding the therapies, then they'll be more open to trying different things, and we can always move a little further into the therapies or try different therapies. And one day they may just be having a bad day and not accept acupuncture, or they may want acupuncture. We all have different types of days. Some days I won't tolerate the NPS. Everybody's a little different. So it's always about working within your child's comfort zones and within their limits.